Fabulous. Fab. Well, welcome everyone and happy Thursday. This is our Connect and Coffee session with Professor Amanda Kirby, where we'll be discussing all things 2024 Neurodiversity Index Report. I'll let her introduce herself in a bit, but it's really great to see some of us here from our network and beyond. Thanks so much for taking the time to join this brief and hopefully informative session. My name is Natasha, and I'm the Relationship and Communities Exec here at the City and Guilds Foundation. A lot of my role is to help build impactful relationships across our communities and networks. So you guys, and put together events like these. Hopefully, most of you will have heard from me one way or the other through our monthly newsletter, which is our way of keeping you all up to date on what's been happening. And if not, no worries, I'll drop a link in the chat shortly so we can get you signed up. At the City and Guilds Foundation, we're all about removing barriers for individuals to getting a job and allowing them to find secure and sustained employment, no matter what background and barriers they face. We've made a commitment to help raise awareness about the barriers that neurodiverse individuals in the workplace face, and have been doing this through a lot of the work, including empowering employers to make informed decisions and adjustments for all members of staff. Earlier this year, we partnered with Professor Amanda Kirby and Do It Solutions to launch the first Neurodiversity Index report, which hopefully we've all had a little bit of a look at. There were some key findings that stood out from there, and I'll let Amanda speak about those in a little bit. But basically 12 months on, we're looking to understand, has the experience of neurodivergent employees in the workplace changed? What changes, if any, have been made to make the workplace more neuro-inclusive? And for the 2024 Neurodiversity Index Report, we're hoping to, further explore these emerging themes, trends, and we'll hear a little bit more about this shortly. All of this work, of course, will be and is dependent on the data that we're able to collect. The more data that we can get, the better a picture that we're able to paint. So hopefully after this session, you will all feel inspired to fill out this survey if you haven't already, claim your digital credential, and share it with your networks. Just a little bit of housekeeping. We do have a chat box, so feel free to pop in your questions. We want this, to be engaging and interactive, and then we'll have a chance at the end to kind of go through the questions. And without further ado, I will hand over to Amanda. Can you please, can I get you to introduce yourself and tell us a little bit more about why we're here today?
Sure. Good morning, everybody, and it's great to be here with you. I'm hugely enthusiastic about the Neurodiversity Index and what we're trying to do. As a collective of individuals, we can really try to understand what is actually going on in workplaces and spaces, in organisations and with employers as well. My background, well, this is what we're talking about. My background has been working in neurodiversity for more than 30 years. I'm a professor in the field of neurodevelopmental disorders. I'm a medic. I've worked in employment, the education to employment sphere for the last 15 to 20 years as well, and written extensively about neurodiversity at work and neurodiversity and education. So I feel, and I come from a neurodivergent family and have neurodivergent children, neurodivergent grandchildren. So I'm passionate for lots of different reasons why I think the index is really important. So what I thought I would do to start with is to run you through quite a lot of slides, but quite quickly, to give you an overview of some of the key findings from last year and what we're looking at and trying to understand for this year. The index last year was the first time this data was gathered. And I think what we've got the potential this year is then to say what change is happening, but we are going to hone in on some things that we picked up last year that we want to understand a bit more. So we've added a few questions in this year, apart from the ones that we're repeating, to look at change over time. So if you've got any questions at the end, put them in chat and I'll answer anything I can. So some headlines. 53% of employers have not adopted recruitment processes to accommodate candidates. Well, the good news is 47% have, so there is some good news. I'm always an optimist in this sense. But if we don't know who doesn't apply for jobs, we don't know what's turning people away when they're applying. And that might be around the accessibility of your application forms. It might be the tick box that says, are you X or Y? And people don't know they are X or Y, or don't want to be defined as X or Y. So we've really got to think about, how do we make those recruitment processes more inclusive in an anticipatory way? So one of the things I'm very keen of us thinking about is universal design. So we are anticipating you will have people applying for jobs, coming into your workforce, who will be neurodivergent, but they won't all have a label, won't all be able to tell you they are, may not want to tell you as well, okay? So we've got 53%. 10% of neurodivergent respondents were met with a poor response. And this was actually, 10% was a very poor response, but there was a considerable number that had not a great response. And we're seeing that recently I posted something as well, asking about where in the process do you feel most hampered if you're neurodivergent? And 47% of people said that it was progressing in an organization. Now, you may not say who you are and tell everything about yourself unless you're really confident about that place is a place where it feels safe to do so. And I think we've got to be cautious about things like bring your authentic self to work, because when you do, people may not like it, or it may not go well. And interpreting what authentic self means sometimes is pretty difficult to do. So we've got to be careful about big headlines that actually can't be interpreted. So people have not always had positive experiences. We've got people who have, and that's one of the things we're going to bring out of the index this year. What's working? So of the companies and the organizations that are doing well, what are they doing? How are they doing it? When employees are having good experiences, what is happening? What are people, so we can learn from those experiences, okay? 40% of neurodivergent respondents said that they're impacted most days in the workplace by their condition. And I think we've got to be mindful of this. We know that individuals who are neurodivergent have got higher rates of mental health challenges, anxiety, depression, and suicidal ideation as well. We know this is a risk for individuals. Having a workplace which is inclusive and recognizing people's talents and supporting them is going to be really important. So we've got to see that impact as well. And that's why that anticipatory approach is so much. 49% of organizations have got mentors and champions of the people who committed to completing this last year. So there are obviously going to be organizations that probably are more go ahead and responding probably. So there is a bias in there in terms of responses. That's why we want to widen it to get as many organizations as possible to complete it. We run a neurodiversity champions program, and we've seen organizations coming along, getting trained with their champions. So they've got somebody who's a signpost in your organization. If you want more information, let me know. What this means is that they're not experts, they're not diagnosing, they're, really dangerous thing to do. A bit like a mental health first aider, they're there to signpost and support, and we're seeing that really important change over time. What we did when we were looking last year, we had a good spread. We had a good spread of sizes of organizations, and we asked things like, how many of your senior leaders have been trained? And last year, we saw about 29% of senior leaders being trained. Now, I think this is crucially important. We need buy-in from senior leadership. If we don't get that, we'll have an awareness that never gets sustained. So it's a big sort of woo-hoo, and it's gone. So this is really important. We need to be shifting this to see that senior leaders see this not as a nice to do, but an important to do. And it means it's going to help with retention, recruitment. It's going to have a lasting effect. And also what we've seen over this last year, we've got more employment tribunals going up with neurodivergent folk coming forward. You have a legal imperative. We've got the Equality Act 2010 in the UK, but in other countries as well, we have a legal imperative to really be inclusive. So carrot or sticks? I prefer carrots, but sticks sometimes people need to be aware. We've got 23% of training in HR. I want to see this going up this year and see whether that's happened, because if HR, EDI, L&D leads are not involved and feel confident in looking at job descriptions, recruitment, retention, performance management, then it's going to be difficult, because what we want to do is be 6 steps ahead and say, okay, if I always had to be in a tribunal, how can I prevent that? And have done all the things that I should do to support this individual. So again, that anticipatory approach. 29% of managers, some training, so that's good. But I want us to avoid the sort of training on, this is on ADHD, and this is on autism, this is dyslexia, this is dyspraxia, because actually the consequence of that is the managers become more anxious because I didn't know what I didn't know. Now I know what I don't know. I'm really worried about it. I'm not going to have this conversation at all. And I think what we're seeing is the manager training coming through is, how do you have better conversations? How do you engage? How do you listen? How do you communicate? And that's for everybody. And the more we can do that, the better. We're seeing 41% had adapted some recruitment processes. So we're seeing those trends coming through, which I think is very good. Very few are using specialist recruitment providers. Maybe we need to be signposting to more specialist recruitment providers who know they're there and they're out there. ERGs and ability and affinity groups. I've seen over this year a growth, but it's, we've got a long way to go. So in larger organizations, is there a place where you can have a conversation, you can learn about people's experiences as well and feed that back to the organization in a safe way? And you're starting to see those champions coming through, which I think is great. I'm just going to click through a couple of these. So the one thing is we're seeing some organizations collecting data. Lots of organizations are not collecting data at all at the moment, but I think there's a question mark about what are you collecting and how are you asking those questions. If you have a tick box to say, are you dyslexic, ADHD, autism, that's a waste of time. Lots of people won't have a diagnosis, lots of people won't know, lots of people don't fit in boxes, co-occurrence or overlap is the rule. So be careful about tick boxes for conditions, because most people, like most of us here today, don't fit neatly in a box, right? And what happens if you need to tick all of them? Is that going to influence you if you're applying for a job? So I think we've got to be careful about why are you asking it and what are you asking to ensure that the data you're collecting is of value to you and also protects that individual and they have equity of gaining a job, sustaining a job. Now, we saw a bit of a split last year of people being committed to neurodiversity inclusion, but, we've got quite a lot that were saying, no, it's not that important. So we've got a way to go. And you think about people, and then disability risk assessments, we've got some people going, this is not important. And I think this is something that this year we want to bring out more, is that some people will have a risk of doing certain jobs. If you're dyspraxic and you're carrying a tray with hot drinks, you've got to risk assess that person. If they're doing a job where they're needing longer to learn a new skill and they've got coordination difficulties, you may need to risk assess. So there is a health and safety part to this, as well as the Equality Act. We really need to be thinking about health and safety as well. And I don't think in neurodiversity, we've been thinking about that or talking about it enough. Great that people are saying we need resources, but still last year, there were quite a lot that were saying 47% were saying not important, somewhat important, okay? We've got a way to go. So it'd be interesting to see if there's a shift this year as well. And attitudes. I think the basis, when you ask neurodivergent individuals what's most important, they do say that people's attitudes are the most important adjustment that needs to be put. It's about communication. It's about attitude that makes a difference to somebody being included. And that commitment, well, we're seeing this split, where some are doing full implementation, but quite a lot not even started on their processes and practices. So it'll be interesting this year to see, is there a shift? And we're seeing more engaging. And then thinking about neurodiversity, sometimes we think about neurodiversity and disability in the same pot. Some organise think about it in a different spaces, because not everybody who is neurodivergent considers themselves to be disabled. But really thinking about if somebody is seen under the Equality Act as disabled, are they getting their support? Are they getting the adjustments put in place in a timely manner? And again, thinking about where you are with those risk assessments. Lots of bar graphs. I'm going to give you a snapshot to go through, really, okay? Now, I think what's interesting last year, which if any of the following you're confident supporting, and I think this was really interesting. There was a flip because there was a score done a few years ago asking about, would you employ somebody who had any neurodivergent traits by conditions? And 60% of people said they would not employ somebody who had ADHD. And I think the increased awareness we've seen, particularly around ADHD in the last year or so, it's interesting. We've seen this flip to saying, okay, we know something about this. But what it's telling me, we've got a way to go for some other conditions which are common: dyspraxia, 3 to 5% of individuals, dyscalculia, 5 to 10%, developmental language disorder, 7.5%, much more common than autism. We've got a way to go to ensure that everybody, when they do share that information, there is some level of knowledge somewhere in the organization to recognize this. That is likely to mean these sort of challenges, even though take one person is only one person with every label, and the whole variations, there's a million variations in terms of individuals who are neurodivergent, at least, okay, because they all overlap. Okay, so employees, what did they say? Last few slides, because this is important. The impact of disability on work and home life was, I think, really important to recognize. Individuals who are neurodivergent often having to work harder, focus harder, fatigue is often an issue. And I think recognizing that impact of home and work, we take our brains with us to work and we take our brains home. So, you know, and the things that are going on at work may affect us when we go home and vice versa. So to recognize that. Now, what we saw that last year, we saw a good reflection of people who've been in jobs across a whole length of time. And we also, from the report, that we had a good variation of people working full-time flexi. So we had a good balance of people who were participating last time. And we saw, interestingly, though, a lot of people with ADHD completing this, which is interesting because you would not have seen this a few years ago, but fewer from some of the other conditions. And that might reflect the fact that some people find it harder to get certain diagnoses than others. As adults, it's difficult to get a diagnosis of developmental language disorder or dyspraxia. And these are their experiences. You know, would they disclose? Well, that's what we're seeing is some caution about disclosure. It'll be interesting this year to pick that up and say, are people feeling more confident to do so 1 year on? I think this is important. The greatest challenges in the workplace: interviews, job applications, creating a CV, searching. These are all the stuff that if you've got difficulties and you're an employer, you'll never know some of this is happening. That's a problem for people because they won't get to you. So this is really important. If you've got difficulty creating a CV and you can't search for your job effectively, and this really means that we need to make our job descriptions simpler, our applications inclusive, and really asking individuals all the way, telling them what's going to happen in the recruitment process, and ensuring that we're providing them with the information saying, if you need help, because we're telling you what's going to happen, let us know, okay? So I think this is really interesting that the top ones are a lot of the pre-employment stage. And then sustaining that work-life balance, you know, coping because you're fatigued, you're having to work harder. And I do think when we think about hybrid working now, what's happened in this last year as well, we've had quite a few people, organizations saying, back to work, you have to come into work. And it'd be interesting to pick up those nuances to see, is that causing more individuals who are neurodivergent challenges because you've got to do your job and do the commute and do everything else as well, when sometimes when you can work from home, create your environment that works for you, it can work much better. But I think this is important, feeling different. So this is really about inclusive practices, communicating with your peers so you're understanding the rules of the workplace. Often it's the hidden rules, not the obvious rules that we need to go through. So we're learning a lot from this. This is the bit that I want to see this year. You know, some people are waiting a long time to get adjustments. And if I look at the tribunal cases, a lot of them being picked up are because a delay in making those adjustments. Percentage was satisfied. Well, we've got about 26% that are not, but we've got quite a few that are satisfied with the support they're getting. I want to know, what is it? How, and understand that more. And we're looking at that qualitative input this year. I think this starts from the onboarding all the way through, okay? And what would make a difference? Well, I think these things like improved communication and attitude, these cost nothing. So if we can actually think about those things and we can understand this year, we'll really understand much more. Now, one of the things that came out last year, I'm going to stop sharing and just talk to you for a second and take some questions, was really around parents of individuals who are neurodivergent, who've got neurodivergent kids, and the impact it has on their choices in the workplace, where the choice of what they do and where they work because of needing to be home. And that was an interesting qualitative piece that we're going to explore much more this year. And we're going to bring out some of those stories really to understand what are the challenges, particularly if you've got neurodivergent kids. I remember when my kids were younger, I really needed to be home, when they came home from school, to do that debrief with. Even if I started working later on, they needed somebody to be there to just do when they came through the door. And this often, from some research that I've done previously, has resulted in female particularly choosing lower paid jobs, choosing not going for promotion because of that. And we're going to look at that a bit more, hybrid working, changes in working practices, and really see if that's hitting particularly neurodivergent folk this year. I'm going to pause there for a second because I've done a big run through, and just see if there are any questions or anything you want me to talk to you a little bit more. I've got some other slides if you want me to, but I thought it'd be useful just to have a bit of opportunity to talk.
Yeah, and thank you so much, Amanda, for kind of sharing those slides, walking us through a lot of good information on there. And I saw the chat kind of buzzing away. There's quite a few questions. I wanted to give, kind of just open the floor. I don't know if you guys want us to read them, or do you want to unmute and kind of ask the question yourself?
Either way, I can go through them. If anybody wants to say their questions themselves, otherwise I can go through them. Right. In my experience, Scott, managers rarely know what reasonable adjustments they can make and rely on being told by an ND person or else just pretending it doesn't exist. What is being done at Sitting Guilds to address this? What could be improved moving forward? So I can talk from the reasonable adjustments piece if you want me to, and then Natasha, if you want to pick that up. I think you're right. I think managers don't know what is reasonable for an adjustment. And there's an expectation that people will say to you what they want. The challenge with that is, if you've never done the job before, it's very difficult to know what is a reasonable adjustment in this set. And there isn't a standard that ADHD people get this, DCD people get that. It depends on the size of the organisation, depends on your job, depends on a number of different factors, what's deemed as reasonable. I think the first thing is having those conversations and working out with somebody. If you've taken them on in the job, so you think they're good enough to do the job, what do they need in terms of training, communication, IT? What do they need to enable them to do their job? And that's a conversation, and it's a conversation any manager can have as well. But managers do need often a bit of knowledge around these are the sort of things that may be helpful to give them a starting point. But I think it is a conversation, and they need to be re-explored. If teams change, tasks change, environment changes, you have to review those. You can't give out the beige paper and say you've done it, right? Off you go now, because that's never going to be enough, right? If things change, you have to change it. Natasha, did you want to come in?
Yeah, I was gonna say we can just kind of go through the other questions, and I'll come back to that. No worries, Scott. I've pinned it down. Yes, because I'm also conscious of the time.
Okay. I feel that adjustments is a hard one. So Sybil's saying this as well. Every ND person is an individual. I feel if the individual not aware of what helps them, then the company should engage in experienced OC health to support the individual utilize the DWP access to work. Absolutely, Sybil. I mean, access to work is there. It's really important. Sometimes as an organisation, you don't have the expert skills. And in fact, there are a couple of tribunal cases where organisations have not gone out and in fact got external guidance, especially if it's somebody who's got, often people will not fall into neat boxes. So a number of the cases that I've seen come through tribunals have been somebody with dyspraxia, ADHD, autistic spectrum disorder, and other medical conditions in one person. That's quite often the case. And you need somebody who's got that knowledge and experience to support you as in HR and the managers to be given the appropriate advice and to risk assess as well. So I think you're absolutely right. And access to work is still there, so use it. It may not be there in the future, but it is there now, so do use it. Stephen, you've got your hand up. I'll take a call from you.
Yeah, hiya. Um, Thank you for this session. Just to come back to the question that I asked above Scott, what does trained really mean? Now, I ask this because I've recently started off my own um, com company looking at neurodiversity combined with lived experience and also my knowledge from my management consultancy career. One of the biggest challenges that I've experienced is that training is so often poor. It gives a stereotyped point of view, and it's quite often used by companies as a tick box exercise, and it doesn't really explore properly what people need to do. I know that this was a data-based piece of research, but what are your thoughts around the types of training and around what national respected organizations, I won't name any names, although I really wish I could, but what could they do differently? Has the research highlighted any of that?
So I think it's a really good question. So I think the key thing, and we haven't got very long to answer it, so I'll try and give you a quick answer. I think you're right. I think sometimes the tick box training is a waste of time. It raises awareness, but often leaves people more anxious in knowing what to do afterwards. And that individuals, the job you do, the setting you're in is complex. There isn't a single answer to go, ADHD people get this and autistic people get that. And I think that sort of siloed approach to training is not helpful in the end. Okay, so that's the first thing. I think that you have to do it. True commitment is training over a period of time that gets then embedded and baked into the systems and processes. Because if you're trying to retrofit and support one person and one person and one person, well, you will, but you have to get the foundations right as well, right? You need to get your systems and processes. So that's why I moved for a universal design approach, which is really going, we know in an anticipate you have got, will get, need to include people at all stages and processes in the employment life cycle, and then be critical and be uncomfortable and have uncomfortable conversations. And I think that's where we have to go, what are we doing? How can we do it better? And measure that and measure change. So it isn't about just a quick awareness session, off you go, you've done it, because actually it won't have any lasting impact. So I think that's why over this last 18 months, we've been looking critically at what sort of training is required, but for different people. It's not like different people within an organization need different types of training. There isn't like, here's the package, off it goes, because HR EDI might need to look at job applications. They might need to look at critically, if they're using psychometric tools, are they robust and are they excluding people? If they're using AI for recruitment, is that appropriate, right? So there's not going to be a single solution here. And as you say rightly, I think including people in your organization that are there and hearing about their lived experiences is really important as well. Okay, so gaining that feedback. Okay, so I think we've got to be critical and uncomfortable.
Just to add, I think that
12 o'clock, so you've got 30 seconds.
Okay, cool. So very quickly, I think that it's also important to look at the training given to the neurodiverse employees, because I'm almost certain that impacts some of the challenges. The other thing that I wanted to say was, as well as the user design, the user experience piece is vital as well. But sorry, I will stop waffling on.
No, absolutely. Thank you for your comments. We appreciate it. So I'm going to hand back to Natasha, and I'll put up the last couple of slides, Natasha, as well, just to share the link with everybody. So my plea is, please join in and do the index this year if you haven't. Tell all your friends. I've now got to the end of the slides, not the beginning of the slides. I've flashed through them very quickly. Please tell your colleagues, friends to complete it. We only know what's going on, and that is gaining that feedback, is actually asking people, and so we need your responses. We'll share the link with you afterwards as well, okay? And if you want a digital credential, please, the Sitting Guilds, reclaim your digital credential as well.
Thank you so much, Amanda, for all of that, and for everybody for participating. I know there's quite a few questions we weren't able to get to, but we've noted these down. Shortly after this, you will receive the recording as well as a link to complete the survey and as well to claim your digital credential. We do hope to hear from a lot of you. Please feel free to, pass on the questions again to me. I'll be in touch with all of you. And yeah, just thank you so much for attending. I know we've run out of time and we probably could have gone on for another hour, but we thank you all for attending, and we hope to speak to you all soon.
Thank you very much. Bye now.
Thanks, everyone.